יש לנו יום פתוח מאוד מיוחד היום. אנחנו, כמו שאנחנו עושים בכל שבוע, אנחנו מזמינים אורחים ליום הפתוח. מי שמתארח אצלנו היום זה שני דיקנים של האוניברסיטאות, ובשלב הזה, שזה יקרה בעוד פחות משעה, הצטרפו אלינו גם מכינות של 23 שהתקבלו כבר לאוניברסיטאות, ומכינת ספטמבר 23 שתיפתח ביום ראשון הקרוב. אז גם משם הצטרפו תלמידים. אני מעריך שאנחנו נהיה מעל ל100 מאזינים בשלב הזה, ואז הצטרפו אלינו דיקנים של שני אוניברסיטאות, מצ'כיה וקרואטיה, והדיקנים האלה ייתנו לסטודנטים שלנו, וגם לכם כמובן, טיפים לשנה הראשונה. זה הנושא שלנו היום. יש לנו בכל שבוע נושא. לפעמים אנחנו פשוט מדברים על אוניברסיטה, לפעמים אנחנו מציגים תלמידים, אבל יש לנו בכל שבוע נושא, והנושא של השבוע זה טיפים לשנה א'. זה אומר סטודנטים שהתקבלו, או סטודנטים שהם בתהליך של מכינה, או כאלה שמתחילים מכינה ממש בקרוב. טיפים לשנה א', איך להתמודד עם השנה הראשונה. מי מכם שהוא רצינית לגבי יציאה ללימודים בחו"ל, זה יהיה מאוד מאוד רלוונטי ומאוד מאוד מעניין.
Yeah, I'm trying to do this. Yes, okay. Let's see how it will work. Oh, yeah.
How are
Hello,
you?
everybody. Hello. Hello,
Hello.
Milan. Nice
Nice
meeting
to
you
see you.
all. Yeah.
So, professors, thank you very much for joining us this evening. With us, we have we invited students from the 2023 pre-meds. Some of them already got accepted and will attend medical studies this year. Some of them are prospective students who will start the pre-med in September. We have a course opening on Sunday, this Sunday, and these students will do the entrance exam in January. And thank you very much for joining us. We have more than 50 listeners and more are joining. And the aim of this meeting is something that we didn't do before, is to hear you as vice deans of the universities, providing tips for the students, first for the entrance exam to your schools, because we still have students who will attend the entrance exams in January, and second, to the tips regarding first year of medical studies. I was just telling the students that the first 2 years, the preclinical years are the hardest, and there is even a dropout of some students. So for us, it's important to hear tips of how first to get accepted, and then how to manage passing the preclinical years. But maybe before you can introduce yourself and introduce the universities. Would you like to start, Professor Aska?
Okay. Could you hear me properly?
Yes, we can.
Hello, good afternoon. I am Milan Raska from Palacký University in Olomouc, Czech Republic. And I'm very happy to be invited to this event. And I would like to say that basically two crucial aspects to be accepted to Palacký University are based on, first of all, preparation, good preparation for entrance exam test, which basically is the goal of most of students, and most of students who enter the entrance exam are able to successfully pass. Second very crucial aspect to be accepted is the following interview, in which students are requested to exhibit their let's say willingness to study medicine, and we are mostly asking why they are studying medicine, what is the principal motivation, and basically concerning to students from Israel, the second part is fulfilled very successfully with we could say 100% success. Means that students are already aware of the future career as a medical doctor, and they are well decided to study. For the first part, we have quite a very nice successful success rate for a written entrance exam, which is based on knowledge from biology, from chemistry, and from physics or math. You could choose one of those two, math or physics, which basically are testing the basic orientation. It's not focused on some very deep knowledge, but basic overview of knowledge. And concerning to preparation course, which is provided by medical doctor, I could say that students are very well prepared. So if we will talk about the percentage, about 80%, 85% students are able to pass the entrance exam. And those who achieve very high score are basically, after interview, offered to be accepted to Palacký, means that they could get confirmation of acceptance within few weeks. Let's say sometimes even few days, depends on the period of year. And those who achieve lower score are still in waiting list, but basically from those waiting lists, we could offer about 80% of acceptance. So basically, passing the entrance exam is a very good warranty to be accepted for Palacký. Of course, Palacký, in comparison, let's say, to Prague, Charles University, smaller university, it has about 20,000 students, and our faculty of medicine is divided to Czech part and part for international students, and we are basically accepting 70 up to 80 students in first year. And concerning to success in first year, I should note that basic, let's say, principle to be successful students of first year is to study properly, deeply, and be focused on study from first day. But I could assure you, if you will adhere to these rules, means study from first day, you will be successful students. That's a basic overview. Of course, if students postpone their study duties for, let's say, November, December, it is quite tricky to succeed, because those duties are accumulating, and students became overwhelmed. But as I mentioned, starting from first day is basic principle of success. And those students we accept for studying Palacký are prone to success. So means it's basically their decision. Of course, they are in, or you will be in new environment, but we have quite a strong support for new students, not only from colleagues from all the years of the same country, like for Israeli students, which are supported by Israeli community, but also from student association in Palacký, particularly in Faculty of Medicine, which is substantially helping to students. And they also generated some subgroups which are focused on solving issues concerning to, let's say, mental health, because sometimes they are challenging situations and students need to get some good advice. And they are really helping, because students also pass some course, professional course for psychology, so they could do some, let's say, triage. And if the case seems to be serious, we could offer psychologists, which is covered by the faculty, psychiatrists, which is part of university hospital. And in case of any other health issues, we are very happy to announce that we succeed to get a general practitioner for our students, which is located right in the campus of the theoretical department. The only requirement is to pay health insurance, but it is in a duty to pay health insurance to get a visa. But health insurance, which is in Czech Republic, is offering so-called excellence of form of health insurance, which cost about 16,000 crowns per year. And this is covering basically everything. So if you have this health insurance, you could act as a Czech people. You will be entitled for any healthcare, so you are not limited in prescription of drugs, in getting any even surgical procedure and everything like that. So this is very important to note, and this is quite new because we succeed to discuss with health insurance company to offer such a very comfortable service. I think it's for introduction enough.
Thank you. Professor Ježek, please.
Shalom and very good afternoon to everybody, especially to you, Moshe, with the long-standing cooperation, and may I also add to a dear colleague, Milan Raška. We meet annually at least once or even twice now. So shalom to everybody who attends this meeting. What Milan actually said overlaps hugely with Zagreb University School of Medicine and the regulation that this particular university and School of Medicine has. So it's again entrance exam, and this is the essential prerequisite. The entrance exam consists of 120 questions. You are supposed to pass with 61, and you should also have some subtest limits to fulfill, and this is at least 16 points from subtests. What are subtests? Subtests are physics, biology, and chemistry. We do not have mathematics or maths, but saying that, I want to point out that you have to earn minimum 16 points from each area. Otherwise, you are not going to succeed. So there are two criteria, basic criteria to pass the entrance exam. One is to earn 61 points overall, and then also to earn at least 16 points in every subtest or subject. As for the other regulations, they also overlap hugely with Milan Raška because faculty, because we are actually the Middle European schools that have the same or almost the same tradition and development. The School of Medicine, University of Zagreb is the largest and the oldest school in Southeast Europe. And it is also striving now to get American accreditation, which it currently has, but we have to re-accredit our studies, and WFME is the organization that is going to re-accredit us in 2024. As for now, as Milan already said, there is quite a good success on the entrance exam, but also concerning American exam, USMLE, we have a huge success rate, particularly concerning Israeli students. They are very well prepared through Dr. Cohen's preparatory course. It depends, to be honest, also on generation. So some generations are better. Usually the January generation or the January shift is very, very well prepared. These are probably the most qualified and motivated students. So I would say that the success rate is 60–70%. It gets a little bit lower in other groups that come in May or in June or July. What is also important to note, we do not limit the number of attempts to pass the entrance exam, but usually people either pass it from the second time of second attempt, or they give up. So this is the regular, let's say, pattern of candidates that we have. We do have also a small short interview after each entrance exam. We talk to the candidate, we also communicate results, and we advise candidate whether the candidate should improve, for instance, in chemistry, physics, biology is, let's say, always more or less okay. As for the success during the preclinical studies, please take things very, very seriously. Medical studies are very, very demanding and comprehensive. So if you start from the very first day, then you are going to be successful. The drop down and drop out rate is relatively small, but it occurs in the first and second year, which are the most demanding, as already stated. We do also have psychological support for students. We are actually now at the process of establishing the general practitioner's office directly on the campus. We got the approval of Ministry of Health, and soon there will be also one team of general practitioners starting from this academic year that will also support health services to international students. There is also for previous generation a number of general practitioners officers that they can you know, go to and communicate with the general practitioner. There is also obligatory health insurance in Croatia, so it amounts, I have to now transfer to euros because we are a euro zone land. So it's 500 kunas. Let me help you and divide this to 7.5, and then you will get a monthly amount for actually euro for this service. It's not much, but I would also highly advise you to pay this because you are entitled to whole spectrum of health services. On the campus, there is a student restaurant. Students usually tend to rent a private apartment, and they usually share this facility, and they also sort of cut the cost in half. Let me also mention at the very end that there are two Jewish communities. There are a couple of kosher restaurants that are offered in Zagreb, and I'm in almost daily contact with rabbis, and they take very good care of you guys. Okay, thank you very much.
Thank you. First question. I'm starting the first year. First question to you, Professor Ashka. What do you advise me to do during the first semester in order to make sure that I don't drop out, that I manage to catch up and I don't drop out? What is the most important thing for your opinion?
In my opinion, it's very important to adhere to suggestion from dean officers, mostly from Yana Osmani, who is involved in contact with students. She will inform all the students about all the deadlines, all the duties, all the activities, all the occasions which needs to be attended to. And second of all, it's important to communicate with colleagues from all the years, as I mentioned, because they are able to provide good advice concerning to organization of the study, organization of attendance to individual disciplines. And of course, another and very important part is to study. But all the students are really willing to support the first year students because they are not just doing it because we suggest them to do it, but they are feeling that all the community of students from individual country and at least from Israeli and of course entire international group is one group of students, and they could provide very good feedback and very good suggestions to organizing the time, because sometimes organization of time means what to do and when to apply for exams, when to apply to tests to get a credit, and so is quite important.
So taking tips from higher years students, I agree. I can tell you students that that's also what I did. I always communicated with students that graduated the year when starting, and I took tips, literature, which books to buy, how to study, which lectures to go to, because in most universities, lectures are not obligatory.
Yes.
So listening to students from higher years, this is the very important tip for the students. Professor Ježek, how would you answer this question?
Thank you for the question. First of all, I would like to point out that there is a kind of introductory week that we have at Zagreb University School of Medicine. So older generations are organizing this introductory week, and they also give tricks and tips to the newcomers, to the very first generation that comes and enrolls the first year. We also have a very, very good informatics system, which is called LMS. So it's a learning management system, which actually has a storage of practically all digital material that you need for medical studies, including some pre-recorded lectures and some digital help that is not something that we want to be the mainstream of the teaching at the school, but is of tremendous help to other students. Also, I would like to point out that there is, of course, a Jewish community and the separate organization. It's the Jewish Students Organization at University of Zagreb that will also provide help, and they spontaneously organized. They are, of course, enjoying my full support, and they will also help you in finding apartment, doing this or that, but you should also make your own steps and inquiries and be very proactive in this respect. If you are not proactive, if you just behave passively and come there, it's of course okay with us, but then you'll probably miss some of kind of internal information that is needed.
Thank you very much. If I may add to this, it is very important to start studying from the first week. So when I was a medical student in Europe, I always gave myself 4 or 5 days to relax, and then I started studying monotonically. There is a huge difference between students who immediately start studying and don't wait for the examination period, to those students who do nothing until the examination period, and then they have all the stress and huge load of material during the examination period. So if I may add to this, it is very, very important to study from day one and not to wait for the examination period. And most universities, they have weekly exams. Professor Rashka, do you offer weekly exams, midterm exams, or just semifinals and finals?
So there are some partial exams, particularly for anatomy, because they are, let's say, surgical weeks and so, and the students are examined, and they do also lots of tests, but we call exam that final exam. Of course, as I mentioned, to adhere, let's say, in biology, chemistry, they are asked to fulfill all the criteria, including tests before starting the practical. So they are some just short tests, a few questions, testing preparation of students for particular practical. And final exam mostly is organized on the end of semester. It's for first year. And starting from fourth year, the students became in so-called blocks. And it means that each discipline is provided to group of students at different part of the semester. And once the block is finished, students are entitled to perform or to do a final exam within 14 days after termination of blocks. Of course, they are entitled to continue with attempts during examination period, which is basically until the end of academic year. But for the blocks starting from fourth year, they are entitled to do exams immediately after finishing the blocks.
And how many, I'm sorry, how many attempts are for each exam?
Basically, we have an examination code which offer 3 attempts for each exam.
Okay.
There is exemption which you could ask for once a study for 1 additional attempt for discipline which is, let's say, quite a difficult for particular students. But in general, 3 attempts are allowed for each exam.
And are the examinations written or oral?
It depends, because we have in some disciplines examinations are performed as a written test. In some disciplines examinations are performed as an oral. And why we do oral examination, at least in some discipline, is that we need to be sure that students as a future physician are able to communicate. Because we are aware of situation of digital resources and lots of communication through, let's say, smart mobiles and so. And we need to be sure that students, and we need to force students to practice their communication skills, and particularly in taking the anamnesis and explaining the disorder to particular patient, particularly in oncology. And so it's very important to be sure that student is able, and the future physician is able to communicate appropriately, communicate with empathy, and this is the way why we are still keeping some examination as an oral.
So Professor Washka, I'm not sure that you know, but we have an English communication skill course in which we teach students how to communicate in English. And we also teach them how to communicate in medical English. So for example, they have to present to an examiner in the pre-med the cardiovascular system, the urinary system, the gastrointestinal system, and they learn how to acquire self-confidence standing in front of examiners and speaking English. This is very, very important.
Yeah.
Professor Ježek, how would you answer the examination? Yes.
Yeah, it's always a very attractive topic. So first of all, I would like to add that, yes, there is a huge, again, overlapping with the system in Olomouc. That means that actually we have a mixture of written exams and oral exams. In general, large exams have, first of all, the written exam, which is sort of filter, and then if students pass this part, they proceed to the oral exam. Of course, each course also organizes what we call colloquia. So these are very small pieces of exam that accumulate throughout the course, and they aim to force, let's say, a student to permanently learn. This is especially particular for anatomy, because there is a weekly quiz also in Zagreb. Other courses like chemistry or biology, they have 2 or 3 partial exams. And you are in constant contact with teachers, so groups in Zagreb are relatively small, and I think they offer a pretty much good possibility to communicate with your teacher. Of course, this regular passing of colloquia or small exams brings you some bonus points that you can present to the teacher at the end of the course. And this is considered by the teacher because then you demonstrate that you worked diligently throughout the course. I think there are some minor courses that only stick to oral exam, or they stick to a written essay or something like that. And yes, I agree with Milan. We prefer, especially after COVID era, to again introduce direct teaching. So digital instruments are of great help to students. For instance, they can review my lecture after I lectured, so they can also review it through this learning management system. But nothing can be a substitute to direct contact between teacher and student. And I think this is very, very, very important.
And how many attempts are allowed for each?
So in Zagreb, there are 3 attempts plus 1 for each exam. What I mean with this is there are 3 regular attempts where you communicate with one teacher. The very last exam attempt, the 4th attempt, is performed by a commission or in front of the commission. That means there are 3 members of commission. 2 are from the same department and 1 is a sort of guest. So these faculty members comes from another department and they examine the student. I would strongly advise you to avoid this 4th opportunity to pass, and it is seldom that we perform this, but unfortunately sometimes we are forced to do so. So all in all, there are 4 attempts with a strong, let's say, suggestion to avoid the 4th one.
Thank you. One of the more important differences between Zagreb University and Palatsky University is that in Zagreb, you study in blocks, and in Palatsky, you study all the materials together. Can you elaborate a bit, Professor Rashka, about your system and Professor Ježek about the system in Croatia? Please, Professor Rashka. We don't hear you for some reason.
Okay.
Yes.
As I mentioned, for first 3 years, we organized the study as an entire group for theoretical, for let's say, lecture, which are organized for entire group of students of first, second, or third year, and thereafter they are divided in practical for smaller groups. Following of the finalized third year, students start to study in blocks. So I mentioned that means that in clinical disciplines they are studying in blocks, means that students are selecting on their own which block is the most suitable for them. And it is very important, particularly for international students, because as you are probably aware, we are offering the opportunity to perform or to adhere clinical disciplines in abroad, like in Israel, for Israeli students, for example, means that they could organize their clinical disciplines to be learned in Israeli hospital. And blog is very helpful for it because they could somehow assemble all the individual disciplines throughout the semester. And we are also able to somehow adjust non-clinical disciplines, which are still part of the study at third, fourth, or 5th year. And if the students are in particular block, they could set the study, let's say, in the way that some theoretical disciplines in 5th year could be performed the first 2-3 weeks in the semester. And after those 3 weeks, they could study, or you as a future students could study in Israel, in Israeli hospitals. The only requirement is that the Israeli hospital should be affiliated to university. It means that it should be university hospital, which is for us some proof of quality of teaching at Israeli side. That's about the blocks.
Yes, Professor Ježek, about the blocks, and also since Professor Ashka spoke about the clinical rotations, it would be good to elaborate on this as well.
Yeah, thank you for this question. Okay, so we have a kind of a mixture or mixed or hybrid system during the first 3 years. Namely, first year is partially organized in blocks. This means that some courses that are short, they are continuous and they end within the couple of weeks or 1 month or 1 month and a half. However, for instance, anatomy, you cannot simply pack it in a block, so that would be far too demanding for students. So this course is stretched over the whole academic year. And some other larger courses are stretched throughout the academic year. In the second year, for instance, there are strictly blocks because we can organize this in such a manner. But then we come to the third year where you have pathology, which is also very extensive, and you cannot pack it in one, package of couple of weeks. So there is a hybrid system. In the clinical part, as Milan already described, there are strictly blocks. So you come to internal medicine, then you come to neurology, then you come to dermatovenerology, and of course, internal medicine would be the largest one, 9 or 10 weeks or 12 weeks, I don't know now by heart. Then dermatovenerology is about 5 weeks, etc., etc. But then you are at one department. And yes, there is a possibility to do a lot of international internships. One is with Tlalit chain of clinics that is situated in Israel, but we can also offer you some Erasmus possibilities. So you can, as our student, you are the student of European Union, so you can move also within European Union, or you can go to United States also. I have to admit, Israelis predominantly prefer Israel, of course, as their, let's say, place of attending clinical courses. There are, however, limits. The limit number one is that the Tlalit clinic that you choose should be obligatory affiliated with the university, as Milan already pointed out. The second point is your mentor should be also a university professor. And this goes hand by hand, so usually it's connected. There is also a limit concerning the number of students that can at once go to Tlalit. So we try to regulate this number of students according to the average marks they got and some other things, or mutual agreement to students. So in short, every student has a possibility to visit Tlalit clinics, but the best students, they get the first opportunity, then the second and the third opportunity according to the success during their course of studies. People go to Houston, people go to Georgia, people go to a number of partnerships that we have also throughout the world.
Thank you. One very important topic that the students may be not aware of or not fully aware of is that the United States accreditation system is changing. And in order to be accredited, in order for the students to be able to do the USMLE and potentially to work in the States in the future, the university has to be accredited by the WFME, World Federation of Medical Education. Can you elaborate on this a bit, Professor Rashka? How do Palacky or the Czech Republic, how do you manage the WFME accreditation?
Okay. Currently, WFME postponed this request for USMLE tests to year 2025, let's say. But basically, our accreditation institution in the Czech Republic is Czech National Accreditation Authority, is already applying for WFME, and our faculty is accredited by German accreditation authority called ASIN, which accredited medical faculties as a part of European Medical Faculty Association under rules of WFME. And because Czech National Accreditation Authority is pre-recognized by WFME and will be accepted according to our expectation next year, means 1 year before the rules will take place, I could say securely that we are in very good position. Basically, because we passed that WFME rules accreditation by ASIN, we as a Faculty of Medicine at Palacky University at Olomouc volunteered to do the, let's say, formal visitation of WFME guys at Czech National Accreditation Authority, which will take place in first half of 2024. And this formal visitation will be the last requirement for Czech National Accreditation Authority recognition by WFME. In principle, in summary, it means that each university which will be in the future entitled to put the students or absolvents to do USMLE should be accredited by accreditation authority recognized by WFME, not directly by WFME, but recognized by WFME. And as I said, Czech National Accreditation Authority is pre-recognized, and final step will be site visit at one of universities in Czech Republic. Particularly, it will be in Olomouc in first half of 2024, after which last step will be the recognition of Czech National Accreditation Authority as an institution eligible to teach students, which will be recognized as an absolvent of university accredited by WFME. So basically, I could say that it's a very secure situation.
So just to make it clear and simple for the students, Palacky University has been chosen to be the example university for the Czech Republic.
Yes, was not chosen, but we volunteered to do it.
Volunteer. Okay, this is important to know that Palacky University is the example university for the Czech Republic, for the WFMD, for the American accreditation system, which is very, very impressive. Yes, Professor Ježek, how does Croatia manage this situation?
Yeah, much similar setting, I would say. First of all, up to now, we were accredited by WFME, and all students that applied up to now, they also are legitimate candidates for the USMLE. However, we have to re-accredit, as correctly pointed by you, Moshe. And so our agency, which is in this case, Croatian Agency for Higher Education, is applying for re-accreditation. It will be, actually, this process will be done by the end of 2023 in terms of application. And we didn't volunteer, but they appointed us immediately as the pattern university and school for WFME accreditation. We expect also the on-site visit of that organization in 2024. so much to Olomouc's situation. This will also take place with us. I have to point out, if you look at the WHFME web page, you will see that not many countries of European Union are accredited still. There are now applying for this. I believe Israel as well. So it is not that they are immediately recognized, so they have to pass the similar process of recognition. In short, we hope to be approved by, or re-accredited, better to say, in 2024, and proceed with USMLE exams. I have to tell you also that the success rate of Israeli students at that exam is quite impressive. The most successful candidates are those from Israel. And this is very important, because if you get this USMLE exam passed, you don't need to pass your national exam, Israeli exam. So you can do it either in Israel or with us.
Mr. Ježek, if I understand you correctly, and it's also important to emphasize towards the students, the University of Zagreb has been chosen to be the example university in Croatia.
Yes,
for
that's
the
right.
American accreditation. This
Yes.
is important. One last question. I always tell students that medical studies are a marathon rather than a sprint. And it's important to do some extra curricular activities. So not only study, but do sport, enjoy Europe, enjoy the city. It's a European city. Both cities are beautiful. How do you see that? What's the attitude of the university towards these extracurricular activities, Professor Ashka?
Or I could say that university is offering lots of possibilities to do extracurricular, not only in area of let's say sporting activities, but also in culture, because we have of course, like any other country and any other cities in the Europe and throughout the world, also cinema and lots of theaters and lots of attractions, let's say concert occasions and historical presentation. Also, Palacký University is doing very nice presentation of movie focused on science. But concerning to sport, university is offering either ability of in-house sport activities, but also is organizing trips to close mountains to do winter sports like downhill skiing, cross-country skiing, or swimming attraction. And as I mentioned, our group of students, which are organized as international students of Palacký University, called PEPA, is organizing lots of activities in between Palacký and other universities in the Czech Republic, or also international. So our students, if they wish, they could participate in, let's say, soccer activities, soccer enterprise between Palacký, Charles, Masaryk University, and so. And they are also able to organize their own activities based on availability of sport hall of the Palacký University, and so I think this is very important. And there are also some regular occasions like celebration of half of the study, which is organized like other occasion together with Czech students, means students of Czech program, which is very appreciated. And I attend to several this celebration, which are very nice because students are communicating together. And the communication throughout the Olomouc, which is basically, let's say, in the shops and so performed either in English, but mostly in Czech, is also supported by Czech students, even during study, because we are offering so-called buddy system, where one Czech student is shadowed by the English students, or English student is shadowed by the Czech students, which is helpful in communication, let's say, with the patients in some special situation. So we are trying to mix Czech students and English students together because it is very helpful to enjoy the life. It's the life, of course, is full of study, but it's not only study. And you know, and you will see that those extracurricular activities are very important to enjoy the study and be happy. Otherwise, you will feel sometimes frustrated, and it is not our goal, definitely.
Thank you. Professor Ježek?
Yeah, almost the same text. So actually, the Zagreb city is very vibrant. There are, besides being a capital of Croatia, there are a number of tourist attractions. You can see also in the city of Zagreb still many tourists strolling around and seeing the various parts of the city. We have several recreational areas that are usually used by students. One is so-called Jarun Lake. It's an artificial lake, but with a lot of bicycle lanes and very nice beaches. There are also tennis courts within the university. There is a student organization that offers these courts to students. There are football matches that are organized by students, and there was also a dancing contest. In previous years. I don't know if it actually died a little bit during COVID, but now I think it's re-emerging again. And in general, I got the impression that students know much more about Zagreb than I do. So, you know, they when we talk unofficially, they say, "Oh, Professor, did you know about that restaurant over the corner here and around the corner there, etc." I don't have any idea. I just work in this city. So they are very much enjoying the city. There is one street which is called Tkalčićeva Street with a chain of restaurants, always full with young people. So anyway, I think it's a very enjoyable now atmosphere after COVID era, and this will of course continue.
Thank you. Professor Milan Rashka, Professor Ježek, thank you very much for being with us this evening. Students who already got accepted, good luck to you. Hopefully you will use these tips efficiently. Professors, students who need to do the entrance exam in January, good luck to you as well. And looking forward to see you very soon. Thank you very much for joining us.